I do have an example of a diabetic patient that's been uncontrolled for years, and he has been followed. We have, in discussing his diabetes with him, he was not very compliant, and so when we reviewed his goals, I talked with him about how important it was for him to follow up and really stress that importance to him. And we, of course, talked about dietary changes, importance of taking his medications and exercising regularly, but he still just didn't get it all. But probably about 9 months ago, he began to make those changes where he's really changed his diet and has become much more interested in that diabetic diet. Of course, he tells me that he can't eat anything now, but he's really implemented those changes, and I saw him yesterday, and his A1C had improved from probably around 10, and he's around 7.6 now, just by making dietary changes and really working. We've adjusted medication a little bit, but he's really implemented those changes, and we've seen the difference in his A1C.
Before, I cannot say that we were a bad office. I mean, we did do patient care, I shall say, very well, but it makes it a lot easier now. We have that pre-visit planning to where we don't have to chase, I should say, patient records. We have it available and ready when they come in. It takes a whole, previously before, it took, an office visit took a lot more time because of we're doing things after the fact instead of before.
I would say it was kind of a lot of different physicians working independently without a common vision and a common goal. And so we are all kind of functioning within our own unit and not really making long-term goals as far as patients were concerned. I think for me, the way I functioned was I saw a patient and dealt with their problem at hand, and I told them to follow up and they came back in, but I never really took the time to really review their preventative health issues and to develop a goal and to develop a game plan for each patient.
Prior to instituting that, we would have to wait for a patient to arrive to get any testing, any really good, pertinent information from them, which would sometimes delay getting appropriate or adequate treatment to them. Now, with patient-centered medical home, we can get lab work done ahead of time, we can get diagnostic testing done, we can actually interview the patient. Someone from the office can interview the patient and get detailed information even before the patient gets here, so that we have a plan of care in place before the patient arrives. The most common chronic health issues are diabetes and hypertension, heart disease, and obesity probably. All of those are intense, in-depth conditions that require frequent follow-ups and monitoring and communication with the patients.
Probably the biggest population of patients that I think is a challenge to really care for and looking at comprehensive care are those patients that are uninsured. And that's where we really work with our community. We have the Health Access Initiative here in Hall County and the Good News Clinic, and we can work with those programs to help provide better care for those patients and get those preventative medicine guidelines covered, and to take care of the laboratories and that type. Our staff really had to kind of step it up. We looked at the staff and kind of the level of performance and their level of training, and began to really draw them into the process as well, where they began to work to their potential, and they were drawn into caring for the patient, not just shuffling papers, but they were involved in setting goals and educating patients and calling patients, and really involved in that whole patient process from the pre-visit planning all the way through to the post-visit call.
Before we had electronic health record or practice management system, we had the old peg board. Nobody probably knows what that was, but you had a peg board with a carbon, and you actually had ledger cards for every patient who came in the office, and you would have to post their charges, payments, and everything on their ledger cards. And at the end of the month, you'd have to add up the ledger cards and be sure everything balanced. That was prior to our practice management software. The practice management software, of course, was wonderful because you're doing it all on computer. With electronic health record, we started in 2001. Actually, when we moved into the building that we had built in 2001, we started electronic medical records then. It made a huge change because I can't tell you how many times I'd looked for charts or had people looking for charts and you can't find them, or heaven forbid the doctor took them home, you never can find the chart, the patient's there. It was a terrible process.
Change is always hard for many different people, and we have many of those people working for us in our clinic. Probably the crowning glory for me was we had one physician that never found anything good at all about the EMR. It was totally horrible, awful, awful, awful. Wanted his papers back. Every day I heard from him how he wanted his papers back, until one day EMR went down. And he was in Sheila's office screaming at the top of his lungs, "Where's my EMR? Where's my EMR? I can't function without my EMR." So it's a gradual process that they grow into.
And then as far as, it helps me, like I can run reports every month on appointments and compare, and say, okay, we had this many more appointments this year than last year because, we're being more efficient. So I think it's helped me see that our numbers have gotten better because we're able to be more efficient and get more patients in the door. And like I say, my phone calls have decreased a lot.
What I hear most from patients is that they're very pleased with the fact that they can come in and get some testing and things done before they even come into the office. And then when they do get here, we have results available for them so that they aren't told, well, we have to wait a couple of days and see what's happening. They seem to be very pleased with the much more immediate information available to them.
Most of it's positive feedback all the way. They're, like I said, they're excited that they can talk about their labs here at the office and not having to pay, we call phone tag, back and forth trying to reach me when they already have discussed their labs. They feel it more comforting knowing that Dr. Gibbs is able to talk to their specialist physician and know what's going on. They can coordinate the care for the patient. They also like the fact that with the refills, they're not having to call every month to get refills. They know they have that confidence in that when they go to the pharmacy, their medication will be there and they don't have to call our office and the pharmacy don't have to call us.
Actually, I have to revert back to something that happened to Mother. There was a situation and there were 3 different doctors working with her on it, and I asked Dr. Gibbs if she would please get in touch with those 3, which she did. They had a teleconference and they together figured out what the need was, and it was so nice to know that the doctor would reach out to these other doctors, because I gather generally that's not done very much, and it's really, really appreciated. It's really needed.
The patient experience, pretty much for the patients that are coming in, we touch base with them before their appointment. It's called it's our pre-visit planning, and we tell them, why don't you come on in and go ahead and get the labs that we need for the office visit. And so they come in and often have those labs done, and when they come in for their office visit, we have those labs available and we review those with the patient. During the patient encounter, we're oftentimes reviewing the preventive medicine guidelines and going ahead and ordering those things that have not been ordered previously. But we also take the opportunity during their office visit to review their goals. So for any patient that has hypertension, diabetes, or high cholesterol, we really review their goals with them and talk about their diet, talk about exercise, and talk about weight loss goals, talk about tobacco. And we cover all of those goals and really work through how to implement those goals. And when they leave, they are given a handout that has a summary of those goals, also has a summary of their vital signs, their medications, and their diagnoses. And so when they leave the office, they have that in hand to look at and review. And then we want to touch base with them after the office visit to make sure they're doing well with any medication changes and to see if they have any additional questions.
actually makes it a whole lot easier. You don't have to, like I said, when a patient needs a refill, you don't have to go look for a chart and pull the chart and see when their last refill was. You don't have to go, the way we do it now, as consult notes come in and ER reports come in, they're actually automatically scanned into the chart. So you don't have to call the hospital to get those. You don't have to call the physician's office to get those. Everything is readily available. It makes it a lot easier when we fill out paperwork for the patient, scan it into the chart, and if they call and have a question, or maybe they accidentally misplaced it when they came and picked it up, we have it here. We can print it out for them and hand it to them. So it makes it a whole lot better and easier.
This is something that I do with you, and well, with you too, because she uses a different pharmacy than I do. When I run out of a medication or whatever, I usually look on the bottom of the label. If it said no more refills, then I call over here and I can leave a message. My pharmacy, I can do it, easily too, and they respond within 24 hours. And I've never had a point where I ran out completely because I stay on top of it. Her pharmacy she has to deal with medications that she does not give them to herself. The Autumn Breeze, where she stays, they have these little cards that are vacuum sealed or whatever, and they distribute them. But Dr. Gibbs works with Riverside Pharmacy. They do that there, and when we've had to have sudden changes with that, they jump in pretty quickly on that.
I see that we're seeing a lot more patients. I see that our overall profitability, the bottom line's much better. Big swing from prior to patient-centered medical home. And I'm seeing, like I say, the patients are so satisfied and they know exactly what their goals are when they leave here, and they know what the doctor wants them to do. They have it in their hand, and it's been great. And like I say, the doctors are, I had one doctor in one of the other departments there working on patient-centered medical home. He said he had to keep up with his nurse now. He was having a hard time because she's ready before the patient gets here. All those labs are there. If they've been in the hospital, their records are there. So the physicians are happier because they can be more efficient and they don't have to spend time doing the things they don't need to be doing, and therefore they can get more patients in. And we always have patients calling, who are sick, who want to come in, and trying to work them in was hard, but it's easier now.
Mostly it helps by providing you with needed and functional information in a very timely manner, which always facilitates your level of care. It means less going back to modify your care. The more information you have up front, the better off you are at each encounter.
I would say it really improves your relationship with your patient, and y'all become more of a team, and that just improves the patient satisfaction. But for me personally, really involving the patient in their care, because medicine is so relational, it's just much more satisfying.
Dr. Gibbs loves the Lord, and for people like us who love it very much, it brings so much comfort and so much reassurance, and you can't have anything better than that, to bond with your physical team.
Everybody would think you say first the doctor, but she's first a person and then the doctor, and that's a great combination.